Hello and welcome to the Queen Bee podcast, where the stories of regional women come alive, resonate and inspire. I'm your host, Tanya Rutherford, and together with a passionate team of women, we've painted this landscape for you. In truth, this podcast is about gathering the stories of women who live in regional and remote Australia to bridge those gaps, to create communities, and of course, to tell the richness in their journeys. Now, if anything does come up for you today, please be kind to yourself. You can share it with us, whether that's through our socials, our Queen Bee community, or you can send us a DM. Hello and welcome to this episode of the Queen Bee podcast. Joining me today is the lovely Danielle Keenan from Broken Hill. Danielle is passionate about equitable and fair access to education across regional Australia. Welcome, Dan.
Hi, thank you for having me.
My pleasure. So I know you're in Broken Hill these days. Is that where you've always been?
Yes, I am a born and bred local to Broken Hill. So my family grew up here, so my parents, as well as my husband's family. So a few generations of Broken Hill bloodline. So yes, always lived here. It's a fabulous place to grow up, and it's a great place to bring up my children.
So tell us a bit about your experience growing up. I've not been to Broken Hill yet. I've been close. I've been to Roxby Downs. I haven't been quite to Broken Hill. So tell us a bit what that was like.
So Broken Hill is in the far west of New South Wales, so it's pretty isolated. So our closest metropolitan area is Adelaide, so across the border into South Australia, and the South Australian border actually lines Broken Hill. So we are about 30 k's, I think, from South Australian border, so far closer to Adelaide than say Sydney, which is about a 12 to 13 hour drive. So we are on a Central Standard Time Zone, not Eastern, as well. And a lot of our community migrate towards South Australia if they are leaving the community. So whilst we are New South Wales, I think we're South Australian blood.
Yeah, so that culturally speaking, it's more aligned.
Yes. Yeah, absolutely. You know, we don't follow rugby, we follow AFL, those types of things. So so it's quite remote and isolated. It's quite a distance away from Sydney, obviously, and that presents some challenges in, access to healthcare. We go cross-border and those issues that come with that. Similar with education, so to progress post-school education, we generally tend towards South Australia. But growing up, it's a really amazing community. The people here make the community. It's a mining town, is our primary industry. So unlike a lot of regional communities that identify as more agricultural, our primary industry is mining. So very, very insular community in that sense, because we don't have a lot of people coming in and out because of how isolated it is. But yeah, just full of amazing people, amazing community. It's all residential mining as well, so people live here and not as transient. So growing up, it was fabulous. I went to a really small school, and really, really loved it. I literally lived down the road in the same street as the school that I went to as a child, and in the same kind of area that I grew up in, because it's just a fabulous place to live.
Yeah. Excuse me. Now I've lost my train of thought. So, and I know you're raising your family here, and I also know you're involved with the Type 1 Foundation. So can you tell us about how you kind of started moving in those kind of circles?
Yeah, so my background actually, I worked in the health service when I left school. I didn't go to university straight out of school, so I worked with our health service and did vocational pathways. So did a traineeship in business administration, and then moved into working for the University Department of Rural Health, which is a combination of, I guess, health and education. It's about recruitment and retention of health professionals and bringing them out to community for longitudinal placement so that they can really embed themselves in the environment, in the to get a real socio-cultural experience in terms of the community and living and working in a regional area. So I had a kind of understand the challenges with accessing healthcare locally, but that was brought to the forefront for me when my daughter, literally 4 years ago today, so this is what we call her diaversary, was diagnosed with type 1 diabetes. And I had, even being exposed to the health sector, really didn't have any understanding about what type 1 means for her and for our family in terms of the day-to-day implications of that. But we also had to access her healthcare services across border into South Australia. So Broken Hill has a general hospital, which has general surgery, a small paediatrics wing, medicine, and an ICU and a surgical unit where they do general surgery. But for any specialist services, we have to access those in South Australia. So 4 years ago today, we were flown out on the Royal Flying Doctor Service after being admitted to ED pediatrics to get her some endocrinology services. So we spent a week in Adelaide educating ourselves and being educated by the amazing staff at the Women's and Children's Hospital in Adelaide around diabetes, the technology that could assist us in managing it for her and helping her to manage it. And it was a real, eye-opening experience, but there's a lack of information around type 1, around the symptoms that present for type 1. So originally we thought she might have had a UTI. She was losing a lot of weight, but we thought that was attributed to growth. But then urinating a lot, which indicated to us that she had a UTI. Eating a lot, where she'd never been a really big eater, and extremely thirsty all the time. And, we took her to the GP. They said, yeah, probably a UTI, did some tests and sent us home. So what we realized was that the health system itself didn't know enough about diabetes to even diagnose her. And we fought really hard for that. When her pathologies come back, the doctor had contacted us to let us know that she needed to come back in, but there wasn't any available appointments for 2 weeks. And I sat on the lounge and Googled why would a 6-year-old urinate a lot, and the two things that come up were UTI or type 1. Read through the additional symptoms and then realized and got her to the hospital. So yeah, there's a lack of information around type 1 and the presentations of type 1. So the diagnosis of type 1s have increased both for juveniles. So it used to be called juvenile diabetes, but it's actually something that anybody can get, an autoimmune disease at any age. So there's been a higher, post-COVID, a higher amount of people being diagnosed with type 1 diabetes as well. So really wanted to advocate around service provision, and also we felt really isolated, didn't have support groups. So that's when we engaged a lot with the Type 1 Foundation and Juvenile Diabetes Foundation. JDRF. So they do a lot of the research and advancement in technology, and the technology that's available to her now really does improve quality of life, overall health outcomes, but also her living with the disease is a lot easier due to the technologies. And I'd previously worked for the federal government for our local federal member. So we became political advocates for JDRF, as well as ambassadors and volunteers for other Type 1 Foundation activities. So we make sure that we bring it to the forefront, show people what it's about, communicate, so they understand the symptoms and the impact on people. So yeah, that's how I got into that. Last weekend we just ran the first ever JDRF One Walk in Broken Hill, and we had around 100 people come out, all in blue and
Wow.
fundraise. And it closes today, the fundraising, but I think we've raised around $10,000. So yeah, amazing effort for such a small community.
That's awesome. And out of curiosity, how old was your daughter when you actually she started showing the symptoms?
So she was diagnosed, so she's about 10, 11, so she was 6. But when I look back on, say, like social media posts of her in the month before, so yeah, pretty much a month from today, you can see the symptoms on her body. So she's
Yeah.
quite pale. She'd gotten quite thin. You could see her collarbone and things like that, and things that her behaviors and fatigue, like looking back now in
Mm.
hindsight, she probably started to develop it, I guess, a bit earlier.
Yeah.
So yeah, yeah, she's very, very healthy, active child now, and yeah, it's hindsight, I guess, that is a bit sad to reflect on, but yeah, she's well and healthy, thankfully.
Yeah, and I think that's the thing that you did get it, and sometimes relying on just our doctors to know everything when there's so
Yeah.
many things, we've kind of got it, and we are able to do a bit of our own research. You've just got to be careful that Dr. Google doesn't wander off and tell you something really random, like she's been, abducted by aliens or something.
Yeah.
I find that really, really interesting because, like, as someone who's not really had anyone with, like, we have diabetes in our family, but it tends to be type 2.
Yeah.
And I always just assumed it was something that they were born with because everyone I'd known was, and I guess when I'm thinking about it, they were in primary school when I knew who they were and stuff. So they
Yeah.
could have developed it at any stage, but I just always assumed that they just, came into the world with it and, it was one of those things.
Yeah, so they don't really know what causes type 1. So it's an autoimmune disease that's triggered essentially by something. And there's been some studies around environmental factors as a trigger, also uh, like illness and trauma, so both psychological and physical. So obviously after COVID, which caused a bit of both psychological and physical trauma in terms of overall health, there's been higher presentation. So they're obviously looking at how that's linked. Some of the information around, and the studies into why people, it triggers this autoimmune response in terms of, damaging the pancreas and the cells that help manage insulin. Some of it, they've found some trends in that, people that have had a recent diagnosis of, say, throat infections or, like, yeah, an illness, that an infection in the body, and later on the symptoms of type 1, you know, start to become present. So there are genetic factors, environmental factors. Yeah, they're really not sure, and they can't pinpoint why it happens. But yeah, it's definitely, and this is why I guess we need lots of money to be
Yeah, and a
put
focus
into
on
research.
it. Yeah.
Yeah, to put into research. My youngest daughter, who doesn't have type 1, we've had her in different kind of research projects where they check her every couple of years to just see if she's developed any of the uh, presentation that might trigger type 1, just so that there's a better understanding of what is causing it, and then hopefully to find a cure one day. Fingers crossed.
Yeah. And how was that as a mum going through that, like for you personally?
Oh, I hate telling this story because I cry all the time. It's very traumatic. It's
Yeah.
like having a newborn baby continually. So last week I was in Ballarat and I was there because I had to go on my daughter's excursion with her. She manages her diabetes really, really well. She has an insulin pump and a continuous glucose monitor, so a Dexcom, and that helps us manage. And the school is fabulous and help her manage it. But she's not very confident in inject. So the pump gets injected every 3 days, and the Dexcom every 10. She's fine doing the Dexcom, but it's a bit complex to do the pump. So if it falls out, she needs someone to re-inject her. So I kind of go, but also she has what are called hypos. So that's where your blood sugar goes too low, or hypers are when it goes too high. And both have impact on the body, but also on the way that she feels as well. So if she has hypos, that's where your blood sugar goes quite low. She gets quite faint, quite dizzy, can't move a lot. And at night time, she doesn't wake up. So all of the devices kind of set off alarms if she's going too low. It kind of helps to manage her insulin, but she doesn't wake up to the alarms. And the excitement of going on excursion does stuff to your blood sugar because your adrenaline and things like that
Everything else comes in. Yep.
Yeah. So she had hypo after hypo through the night. So I had a cabin next to her and had to keep going in and fixing her. So the challenges are continuous and they change as she develops and goes through puberty. But I guess the impact for me, seeing your child sick, seeing them really thin and unwell, and then also trying to manage with the whole education around it, but also realizing that this is a forever thing. It's not something that she's going to get better from. There is no cure. So that was pretty traumatic in that, she didn't want to have the injections. When she was diagnosed, we had to work with the nurses. So she just didn't want to have her needles. She had to have manual injections 6 times a day to get her levels down. And we had to physically restrain her to give her the injection. And I, at one point, just absolutely melted. I just couldn't keep it together any longer. And we just had a hysterical fit of crying after 2 nurses and myself had to physically restrain her and jab her with a needle. I think it was around day 3. And then she started having her injections. But I realized at that point she'd never actually seen me cry. She'd never seen me break. I had cried when she was first, in hospital, but I did it in private with my sister-in-law who kind of come to help me, I guess, check on me. So I did that in private, and then I realized it was a bit eye-opening that she'd never actually seen me cry before or seen me worried in that way. So for her, it was the pain of seeing me upset, because she's quite empathetic, outweighed the pain of the injection. So it was a very traumatic time, and it's a daily struggle, and sometimes you just can't figure out what's going on in terms of her levels. But it's definitely a new normal, and it's quite challenging for everybody, the whole family, but particularly her.
Yeah, I can sort of appreciate some of that, because my daughter's also about to turn 11, 2 days actually. So by the time this comes out, she will have already turned 11, but she hates needles and she just tenses up so much. And her whole thing is, I don't want it if I need to have a needle.
Yeah.
And it's almost like a psychological thing for her. So everything is so distressing to try and get to happen.
It is so psychological. When we do every 3 days, we have to inject her pump. And it's the same thing every time. Like, you can see how anxious she gets. We'll get it all ready and ready to put in, and we use
tenses up, makes it worse. Yeah.
And just starts running around, moving around, doesn't want to sit down because she just doesn't want to have it. And that's generally when she gets upset and wishes that type 1 there was a cure and things like that. But she's been doing that for 4 years, having injections, but it kind of psychologically doesn't get any easier for her, even though she knows it doesn't really hurt. We do everything to make sure it doesn't hurt her, but it's just injecting a huge long needle into your leg, it doesn't fit. You're meant to protect yourself from harm, and it doesn't work when you're having to inject yourself every couple of days.
Yeah, poor darling.
Yeah.
Okay, so you've got that.
Yeah.
and you've also been previously centre manager for the local country universities centre. I'll get it right this time.
Yeah.
And now you're sort of the national student success director. So tell us a bit about that side of you.
Yeah, so it's a very complex organisation. I'll preface this. So I was formerly the centre manager of what we call Country University's Centre Far West, so for the Far West region, and CUCs were created 10 years ago through community desire and community-driven approach for um, uh, to increase the skill level of the population in Cooma, which is Snowy Monaro. So Snowy Hydro is located there, and skilled workforce. They could see that they've got migration of community, lots of vocational, vocational is still extremely important, but they had approached universities about delivering different courses and coming into community, and it is quite a small community. So it was called Cooma University Centre at that point, and it was funded through, it was a locally developed board and funded through sponsorship of the Snowy Hydro project. And that was in existence for 5 years. And then the founder, Duncan Taylor, advocated for some funding through the New South Wales government, and then extended into Broken Hill and Goulburn as the first two centres. So it was a very new concept at that point, but each of those centres also had to create their local board. So CUC, where I work now, which is called CUC Central, so I'm the Director of Student Services, communities essentially affiliate into the CUC brand. It's the brand, it's the resources, it's the model of service delivery, policy suites, all of those kind of things that you get to support the development of a centre. But it really is locally owned and operated. So it has a community-based board, and they recruit generally from the local community to support the running of that. So yes, I started that in that role 5 years ago, 6 years ago, in 2018. And yeah, it just, at that point, under that funding, where there was really no idea about how many people in community would be already engaged or would want to engage in higher education. Broken Hill, like I said, is a mining town. So there is, great opportunities for employment in the mining sector straight out of school. So yeah, we just really had no idea about how it would be perceived by the community. And at that point, under that New South Wales government funding, it was 2 years for the establishment and running of that centre. And we had a KPI of around 90 students at the end of that funding. So that 2-year funding period, we got 90 students in the first 3 weeks of opening. So by the time, the official, ribbon cutting by the politicians who funded us came out, we'd already exceeded the funding KPIs. So there was definitely a need for it in community. The model of service has changed over time. So what we found is that students were really wanting some academic support, and we developed at CUC Far West the Learning Skills Advisor program, developed some best practice guidelines around how to support students in a general way. So it's not subject specific because we don't come under TEXA or any of those kind of regulatory requirements, but how we could safely and ethically support students on their academic journey so that they could be successful at higher education. So we started that there. We received additional philanthropic funding to run that Learning Skills Advisor program across our other centres. So we've expanded over time. There are 23 communities that have CUCs, and we have the bulk of Eastern Australian centres, but the federal government funded similar, what they're called regional university study hubs now, across the nation, because they could see the success. There was also one in Geraldton that operates, that had been operating for quite a time as well. So there's been a huge expansion. I think there's 64 centres now across Australia, and the government has just announced additional funding to open more. So to double the number. No, sorry, there's 35 centres across Australia, and they're going to double the number. Some of our centres aren't funded under the federal government, just New South Wales. So there's more than what is funded under the regional study hubs program. But yeah, they've seen some really good success. So I transitioned last year into CUC Central, and now I help support all of the centres in the CUC network to deliver their best practice student services, so their best practice support. We do that under an equity model, and we wrap around students. So the technology in a place, a learning community that enables that peer-to-peer and peer-to-community conversation around higher education is really important. Plus the administrative component of that, like how to enroll, what the dialogue around university, or the terminology, what does census mean when majority of our family and friends haven't gone to higher education, significant proportion of our students are first in family. So to be able to access that support in those administrative processes with university as well. So and there's a wellbeing component there as well. So we really wrap around students and build participation for them to progress to higher education, and do a fair bit of outreach and things like that into the schools, and really work with the local community. So in Snowy, which is our longest centre, and it's been open for 10 years and over 2 census periods. So we've got quite a bit of data. So in regional, non-metropolitan New South Wales, across the same period, there was a 17% increase in participation of students going into higher education, people going into higher education. In the Snowy Monaro region, in the same period, there was 64%. So really, really increased numbers of participation in that region, that we hope can be attributed to the CUC, and we're seeing similar trends across our other centres as well. Higher participation where these centres are than the rest of non-metropolitan New South Wales.
And I would imagine as well that those students that are getting that support are also more likely to finish their degrees than they might have been otherwise.
Yeah, so it's really hard to track the attrition
I know.
data.
I've tried doing it before with my learn stuff. It's a nightmare.
Exactly.
But yes.
It's really challenging. But yes, the attainment seems to be higher. Anecdotally and qualitatively, we collect a lot of feedback from students that say, they wouldn't be able to do it without it. I am a student as well, and I had a few false starts prior to the CUC, but even just being as a staff member and being in that community and also accessing the academic support, I can honestly say that I wouldn't have succeeded in my postgraduate qualification if I didn't have that centre there.
Yeah. No, that's huge. So tell us, is there any sort of advice or messages that you would share with other regional women who might be, unsure of where they need to go, in terms of what's their life course, and, how do I follow my passions, and how do I follow my interests and make a career of it? What sort of advice might you give them?
I'm not sure. So personally, when I was younger, I was very much, and I guess it's from my upbringing, because my mum has influenced me a lot in terms of social impact and social responsibility. So I always had an affinity to work in that area. And when I did leave school, I thought I was going to be a social worker because, in regional communities, the professional people that we do see and the people with, post-school education are health, social services, or education. And so I tossed up all of those options, I guess, those 3, because that's what if you can see it, you can be it type of thing. But I always say I kind of ended up, there's a little bio from my year 12 yearbook that my best friend still has to this day and sent me, and it talks about wanting to make a social impact. So I've been fortunate that even as my professional skills are actually in business, that I've been able to take opportunities when they've arisen that really sat with my values. I think there's so much opportunity for women in regional communities to participate in different and diverse careers. Being, we need educators and nurses and social workers, but there's also a real breadth of opportunity outside of those options. So understanding that as a regional person, you have choice in terms of, your career, progression or post-school options. There's a lot of variety out there for us. I think one of the challenges that women face and regional people face is that there's a lot that you can do, and you do get asked to participate a lot in things, and it can be quite draining because if you are quite active, it can be you're the person that people kind of pull in. So I think for me, it was really just about grabbing opportunities as they arose and making sure that they aligned with my values, and that to date has served me really, really well. So I think don't feel like you have to be pushed down one way or another. Think about who you are personally, and seek out those opportunities, and be proactive in what you want, because the last thing that I would want to do is work in something that I didn't have energy for, that that was just a job. It needs to be bigger, and it needs to motivate me, and I'm definitely motivated by the work and all of the jobs that I've had, really.
And sometimes, like, because I know I started out in accounting, which is not my passion at all, but sometimes you can find something in each of those roles that are on the path that you can connect in with, just to keep you going until you find that right opportunity as well.
I also think learning, like whether it is opting into formal study, or whether it's professional development or short courses, or getting mentorship from someone in an industry that you're looking to go into, that continuous learning, whatever form it comes in, is so important, and it really does evolve both your skills, your passion, and also your value to other organizations as well. So learning in whatever form, take those opportunities as well as the jobs, the work.
And if you could go back in time and give a message to that Year 12 student who wanted to make a difference, what would you say?
I would say continue to be open. So I think I often think, well, I wonder what life would have been like if I had have gone to university, because it meant for me I had to leave my home. I had to relocate. Things that are challenges for regional people, I was very much scared of, like catching a bus, because we don't do that. Riding public transport, I would have no idea. Navigating big areas, understanding like traffic and things like that. They were really, really scary things for me. But I guess I would say be brave, try everything, and keep those values in mind.
Awesome. And is there anything else you'd like to share while you've got centre stage with us today?
I don't know. I think I've gone over my whole life story.
Awesome.
I think
we're still missing, a whole lot. Well, there's no way we could cover your whole life story in a short period of time. Some interesting points, yes.
I guess the last thing I would like to say is, being a regional person, it isn't a deficit. It's such an amazing, amazing community, whether it's Broken Hill or other regional communities where all of our centres are located. I've been to some fabulous places, and there's one common thing, and it's the people and the community spirit, and they're just fabulous places to be. So if you're ever considering relocating to a regional area, definitely do it, because it's an amazing opportunity.
Yep. Awesome. Thank you so much for joining us, Danielle. It's been really, really interesting.
No worries. Thank you for having me. And I'm sure I'll see you again on a conference circuit, or
for sure. As we do.
Networking as we do.
So today we've been yarning with Danielle Keenan, Director of Student Services with the Country Universities Centre, volunteer with JDRF Advocacy and a passionate advocate for education support and services in the regions, and also, as we've been hearing today, about awareness and research on type 1 diabetes. The Queen Bee podcast delves into the heart of regional women's experiences, their aspirations, challenges, and journeys. It's a platform that celebrates their individuality, their resilience, and their ambition. These tales of reinvention, adaptation, inspiration, and the power of connections.